The Swachh Bharat mission aims to improve sanitation and solid waste management across the length and breadth of India. Since the launch of the mission in 2014, urban local bodies have begun to take massive strides in ensuring that all households have access to a toilet. No one needs to defecate in the open, and that waste is collected and processed safely. Urban local bodies, state and central governments, and citizens have joined the national movement to make India free of open defecation by 2019. To achieve this target, cities need to begin by identifying hotspots and priority areas where the gap is maximum. Sanitation mapping is one such tool to help identify such problem areas and plan for them. Let us find out how sanitation mapping can help. The census from the Government of India provides a lot of statistical information like the number of households lacking latrine facility, number of slums. But certain data like vulnerable spots of open defecation or OD, garbage dumping areas, and public and community toilets in the city are better understood in spatial layout of the city map. Let us take a simple example. People may resort to defecating in the open due to lack of individual toilets or community toilets, or due to a long developed habit and lack of awareness of the health effects due to defecating in the open. Specific reasons need to be identified for each settlement where residents defecate in the open through primary surveys and focus group discussions. Such areas, when marked on a map, will give a clear picture of the areas in the city that are more prone to open defecation than the others. Such map data can help to determine the following: which areas lack individual household and community toilets, in which areas open defecation is more, whether the existing public and community toilets are adequate, what is the condition of existing public and community toilets, what are the citizens' views regarding usability of the toilets, and other such crucial information to understand the gaps. One such extensive sanitation mapping exercise has been done by the city of Visakhapatnam in Andhra Pradesh. Let's now learn how this has been done. The need for sanitation mapping was felt when Visakhapatnam, even after being declared as the 5th cleanest city in India on 15 February 2015, was still not free from open defecation or ODF. In order to improve sanitation and become ODF, the city decided to take up sanitation mapping project in all its wards. Recently, it has been declared as the 3rd cleanest city in the Swachh Sarvekshan 2017. Water and sanitation for the urban poor. Advisory WSUPA initiated this process by understanding overall condition of Visakhapatnam. As a part of the US aid-funded project, technical assistance was provided to the Greater Visakhapatnam Municipal Corporation or GVMC to plan, implement and monitor urban sanitation activities. Urban Management Center or UMC, an Ahmedabad-based NGO, assisted WSUP to carry out sanitation mapping exercise in Visakhapatnam.
We started to look around and decided that we need to have a good grasp over what is the sanitation situation in the city. And we therefore decided that the first building block or the first step towards doing this precision in making sure that the access improves was to have a sanitation mapping for the city.
The first step for sanitation mapping is to collect relevant secondary data.
First data set that we required was with regard to where exactly are the points in the city by their coordinates where the defecation happens. Which are these sites?
The biggest challenge any city faces to end open defecation is starting with reliable data and updated data about where open defecation is happening in the city. Vizag started this process by doing a mix of primary surveys and collecting secondary information. We started the process by having one-to-one discussions with all ward officials of different wards in Vizag city to understand what were the local challenges they were facing in the wards with respect to open defecation, where were the public conveniences located, where were the garbage dumping spots in the city, what was the cleaning schedule of these public facilities and garbage spots, and is there a monitoring mechanism which the city has put in place to make sure that these spots stay clean. We collected a lot of water supply network maps, sewerage network maps, stormwater drain network maps, and tried to overlay them on a GIS database.
After receiving the secondary data, the next stage was to create a database management system.
Based on all the primary surveys and the secondary information that we gathered from the municipality, we created a base map, overlaid all this information, and developed an integrated knowledge management tool which had an interface with GIS. It was important to train the municipal officers and the development authority staff for using this integrated knowledge management and GIS tool. We conducted a week-long training session with about 10 officers in the municipal corporation and the development authority.
Secondary data has to be coupled with on-ground primary surveys and feedbacks. For this, the survey teams were formed and trained. Primary surveys were encircled around OD sites, PT or CTs, and focus group discussions in the slums.
We conducted a primary survey of open defecation spots in all 72 wards of the city. And as discussing with the people, we were discovering many more new open defecation spots.
UMC's Android-based City Collect application was used for recording field survey data. This included geotagging of locations.
This ward level input that we got from the local field officers was then correlated with a mix of secondary and primary data that we collected from the municipality. A wide range of reasons came up, right from access to individual toilets, to adequacy of number of toilet seats in the public conveniences, to cleanliness of public conveniences, or the distance of their public convenience from their residences. We also discovered that a lot of children were defecating in the open. A large reason for why children were defecating in the open was because of inadequate number of seats and absolutely no child-friendly design features in our public toilets.
So together with Urban Management Center from Ahmedabad and Visakhapatnam Municipal Corporation sanitary inspectors and the assistant engineers and the junior engineers, we sat down and did what is called as ranking or scoring of the community toilets. We could do the scoring based on certain set of indicators or blocks of indicators which were fine-tuned subsequently, and then we scored and we knew that these are the community toilets which are functional, these are dysfunctional, and for what reason. All that was enumerated as part of sanitation mapping.
All of the collected data is then analyzed with the purpose of figuring out the existing gaps. All the data that we got through primary and secondary form was analyzed. Thematic maps, buffer maps and proximity maps were prepared to understand ground reality.
What we did was that the sanitation mapping helped us to understand that which ward has how many open defecation sites. And what we found was there were 12 wards out of 72 which had 1 or 2 open defecation, where the open defecation was happening. So we could quickly identify small victories that could be undertaken by the urban local body. So these were the first set of 12 wards which achieved their ODF status very early on. And they served as an example for the rest of the city.
Another case of such mapping is of Ahmedabad. The city had already provided toilets to 35,000 households by the time the Swachh Bharat mission was launched.
How do you know the toilets are not there? It's not adequate when you see open defecation spots. So what we have done is we have surveyed each and every open defecation spot in the city.
Open defecation spots in the city, we started putting them on a GIS map of Ahmedabad. And when we overlaid it with all the slums, all the slum-like settlements and all the public toilets and community toilets which are there in the city. And that's when we began to understand that what is the reason that people are defecating here. Do they lack individual toilets, or do they lack public toilets, community toilets, or that the facilities are so bad that they cannot be used. And when we have these geotagged locations and the geotagged photographs, it's very easy to then put it on a GIS based map and then work on the map.
In order to make open defecation free cities, the focus should not be only on the provision of toilets, but sustaining them through mechanisms which can cater to the vast growing areas.
Engaging with the community is crucial to bring participatory approach into the picture and hence reach to the grassroots level. This helps in efficiently planning for sanitation of the population. Sanitation mapping is a foundation step towards achieving and sustaining open defecation-free city. Cities should create maps using secondary and primary survey data to identify gaps in sanitation coverage. Identify open defecation spots and help analyze reasons. Identify spatial coverage of public conveniences. Create systems to ensure updation of the database. Engage with the community to understand ground issues to design appropriate interventions.
एक कदम
स्वच्छ भारत का इरादा कर लिया